welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Eros Chaves, a periodontist, researcher, educator, and former private practice owner whose career has spanned more than 4 decades across the country. Dr. Chaves has trained hundreds of clinicians, led university departments, and brings one of the most honest, experienced perspectives in the profession. Today, we're diving into what's changed, what still needs to change, and where dentistry is going from here. Let's get into it. Thanks for coming on the podcast, Dr. Chaves.
Thank you, Nick. Thank you for having me on your podcast.
Yeah. So, I mean, before we get into, all the work you've done all across the country for 4 decades, what originally brought you from Brazil to the University of Michigan back in the 90s?
Yeah, in 1982, I came to University of Michigan Ann Arbor, and I want to learn more about periodontics. Those days, there were many longitudinal studies. What that means, they had patients being treated for periodontal disease in 1960s and then 1970s, and they reported the results 10 years later in the journals, periodontology, in the scientific journals. So I was curious to learn how they could do that, and I was very lucky to be accepted in the program. And then after that, I was hired as a research fellow for a year, 1984 to 1985, and then I could see those patients that they treated. They were more than 400, and I got a lot of inside experience besides publications, how they were able to maintain a natural dentition for so long.
Yeah. Well, and
That
from
was
there,
very
you
interesting.
ended up opening your own private practice, right?
From there on, well, because I came with a scholarship, I had 3 years that I went back to Brazil to pay back my scholarship from Brazil. And I came then in 1989 working in San Antonio, Texas, in the Department of Periodontology, and that was my way back to the US. And then I spent time in San Antonio, Alabama, Houston, Pittsburgh, opened my own practice, and went back teaching in West Virginia, Oklahoma, and then I stayed the last 10 years in Florida again in my private practice.
So,
That
what's it
was
like going back and forth? Like, what were some of the pivotal moments that, shaped your philosophy going from private practice to academia?
one of the things that took me back to Florida in 1999 was because there was a sideline that I was hired by a research company called Hilltop Research at that time to do some consumer product testing, to be the director there. The company was in Miamiville, Ohio, but had a site in West Palm. And then I went to Florida working in that company. I was able to open my private practice as well. I want to try. I want to see how it was. And I did it. And I had a practice in Juno Beach, Florida. Palm Beach County. And yeah, it was a great experience. I learned that I need to know more about business to open a practice. And then when I went back to West Virginia, teaching, we were able to open a DMD MBA with the School of Business. And many dental schools in the nation, they have this program. I don't know if everybody knows, but they apply for the dental school. They also have an opportunity to do one more year to obtain an MBA because some of the credits overlaps. So anybody interested in going to dental school, they should check on the possibility of doing an MBA, a Master in Business Administration as well. So there are so many opportunities in education that sometimes you're not exposed to it when you apply. The same way when I went to Michigan, I learned I could be in the research area, I could be in the clinical area, I could be in the educational area. Your horizons gets really wide,
Yeah.
really wide.
Well, throughout all that, in 4 decades, what are some of the biggest changes that you've witnessed firsthand in the field?
Well, right now, what I feel the most is that these longitudinal studies, as I told you, that would follow patients for 10 years, 12 years, they became a little bit more difficult because the industry is so fast that when you try to demonstrate something that's going to last 5 years, it's already obsolete. It's already gone because they have a new product that's better, right?
Yeah.
So these longitudinal studies, they became a little rare. Also becomes very difficult over time to follow people because they move much more than they used to, but they disappear. So every study now is a little bit short term. There's a lot of good technology and they show the beauty and the cases that becomes really fantastic, but it's all short term. And that's what we have to learn if this is going to last.
I mean, is there anything in particular that you feel like education needs to catch up with as far as technology in the industry moving fast?
I think so. There's so much to catch up there. Is trying to to work together with the industry in a way that we are serving the patients the best, right? Like I tell my residents, we have to serve the patient. You make a treatment plan or select a product or whatever, and you say, is this the best for my patient? Is that what I would do to my mother or my dad? Very basic stuff. I think start getting easier to decide because the choices are so many, and also the cost, finances of patients and things like that also gets higher and higher because the industry is getting involved in dentistry and getting more expensive. So what would we change? I think I'll go back to basic, what is the best for the patient,
Yeah.
and go back there. It's very difficult today because I understand the students are leaving dental school with much more financial constraints and challenges than I did, right? I came from another country. I had out of state tuition and it's much less expensive than what it is today for an in-state tuition in some places. So when they leave dental school, many students have almost $500,000 loans to pay back. That's difficult. That's a challenge, and the American Dental Association is trying to solve that. They have opportunities to work in healthcare, and they pay these loans back if they work 5 years or 4 years. There are some opportunities there. There are also the military, like the Navy, Army, Air Force. They will help them with that as well if they want to work in specific places. So there are opportunities there, but it's not like it used to be that you could go anywhere you want. I don't know if I
Yeah.
answer your question in terms of the challenges for the new dentist.
Well, what about from a clinical perspective? Like, what would training look like for, to prepare that? I mean, I know you're still, an educator, but is there anything like if you could invent your own training methodology in this day and age with the changing technology in the industry, what would that model look like?
That's a good question because I think a little bit different than what it is. All the models is student driven, right? The student has the patient and the faculty sits there and check in and checking out. I would be more favorable to the medical system where they are residents and they follow faculty members. They work in a hospital or something like that. So the patient would be assigned if they're going to learn. The dentist would work 2 years in a basic type of learning with the labs and the computers. They can practice a lot more today than they used to. And after these 2 years or 2 years and a half, they would come now with a faculty member assigned maybe six students, undergraduates, and then when they become residents, also the same story. And the patients would be assigned to the faculty. So when the student graduates today, they say, "This is my patient." I tell them, "This is not your patient. You graduate, you're gone, right?" And the poor patient is lost into a system, right? Because the student that they had the link disappeared, graduated. So if I had a choice, I would have the patients assigned to the faculty or whatever, and the faculty would have the students under them that would be teaching, okay, you're going to do this and this and this. Now, this idea many years ago was flying a little bit with, they call team leaders. This 1995, but didn't work because the team leaders sometimes didn't have the experience to control 10 students under them. They are not clinicians, they were educators. They have other responsibilities, administration, publishing, doing research. So they are not there full time with patients. The schedule gets messed up. There are some challenges, but I still believe that you have clinicians take the responsibilities of publishing or administrations from those team leaders and keep them in control of all the patients. So when you go to the school, you say, "Oh, Dr. Chavez is my dentist," right? You have a link instead of, "Well, I have the student Smith, but he graduated. I don't know who I'm going to see now." So I would change that system of being student driven by being faculty driven. But when I say that, somebody's going to say, "Oh, we had that before." Well, maybe you didn't have the right faculty members, because they were educators. They never had a practice. So becomes a
Well,
little bit difficult to run.
well, and that's a good point right there. That I mean, what have you learned having run a practice that you feel like education's missing out on?
Yeah, exactly. Is to know this, all the complexities in a way of starting with the staff members, then having all the systems working from telephone calls, from insurance, from the staff members, from timing, from expenses. Because when you're in the school, you use everything you want. You don't know how much it costs,
Right.
right? So they don't learn even that it's going to cost money. They can't do that. One patient spend, everything they want. So that's what the office is going to teach you a lot. And that's why the business part comes in, right? And this morning, a student of mine told me, a resident told me, I would pay double tuition if I didn't have to schedule my own patients, if I had somebody schedule for me.
Yeah.
And I felt like, but that's what should be. The school should not rely on you scheduling your own patients. But for whatever reason, is lack of staff members or cost, the schools are not set up for that so well. When I say that's throughout the United States, not one here, one there. In the offices, the private office, they leave on scheduling up front. If they don't put me patient in the chair, I have no work, right?
Right.
So it's very important that my team knows what they are doing. What does not exist in the educational system, because the patients come to the school because it's less expensive and they feel like they are going to be well treated, and it's true, but takes too long sometimes. Takes too long. They waste so much time. So I would change a little bit as you ask me. I would make more a private practice enterprise, what the physicians do.
Yeah.
The medical system is like that. If you want to have sometimes the best treatment and heart surgery, you go to an institution, right?
Yeah.
And you are treated really well. So the same thing should be in dentistry, in my opinion, if they use more the labs and the technology to teach them before they see a real patient.
Right. Well, with the ever changing and speed that technology's growing in the industry, do you think that we're losing some maybe some a little bit of craftsmanship in dentistry?
Well, the technology would help a lot to prepare them to go to the clinic. On the other hand, it's taking a lot of the craftsmanship, like you said. For instance, all the work we used to do with gold is disappearing, right? Because now we use systems, digital systems, that they can cut a crown in a zirconia or something like that much faster. There are some requirements for that not to break and to have some good adaptation, but that depends on more the machine and the digital situation that they are doing, and sometimes it doesn't come as perfect as would come if was doing with, like you said, by hand of a dental technician using gold, for instance, right? But it would be so much more expensive today. That's the other thing. We are making more less expensive because of the technology that's behind.
Yeah.
And everybody talks about AI now, AI to make diagnosis. But the issue is somebody needs to give that information for them, the machine to give the correct answer. And this is an old story, but yeah, my old faculty member, Dr. Rumfier, he's already passed away, but he used to say that it was garbage in, garbage out, right? He's a Norwegian guy, very dry.
Yeah.
Say, this is all garbage in, garbage out. So yeah, you have to be careful what your information you're feeding, because that's how you're gonna get it.
Yeah, and I guess balancing speed and convenience with the technology. I mean, how should clinicians approach that for long-term biological success?
For biological success, well, it's going to depend, like I say, what you have. We call ethics, right? But so what do you carry with you, and is that the best that you're providing to the patient? Is that the best situation for the patient? And then we need to start fighting a little bit more for the dental labs to be better, for our assistants to do the right thing at the right time. It's a team, and the team has to work together, and many clinicians form this team, and they do have that, right, over time. They develop that. For a young clinician going out is difficult because they have to start all over again, right? If they associate to somebody already established, it becomes a little bit easier. If they have to go from the scratch, they have to find out, okay, what's the lab I can work with? Who is the oral surgeon that will support me if I need it? Who is the endodontist, the root canal specialist, that will support me if I need it? Who is the periodontist that's going to support when I need it? And then you form your team. It's very hard to do everything yourself, in my opinion. It's very
So
difficult.
yeah, and how I mean, how would you say what would be the best way to get, these systems, the dental and medical, in like a holistic manner to work together instead of operating independently or siloed away?
I think the system is pretty slow, right? Everything goes slower than I would like it, because in my lifetime I'm not going to see that. But right now, for instance, many schools, North Carolina already, I know, is already using, Alabama is going to start using, is a system where it's going to coordinate the medical record with the dental record, right? So everything that the patient goes and all the medications they take in the hospital, we are going to know in the dental school. So that integration is going to start moving towards what I think is going to happen. That's more treating the patient, not the student being the leader, but the faculty and the system, the university or the hospital leading that patient. He's not going to be lost because the record is going to be a single record that's going to be for everyone to see it. I think that's a great beginning. They call this system Epic, is the name of the new software that they're going to use. They're already using other schools. There are some private practices already using DSOs, they call. They use that, but the information has to be put in, right? If you're taking Plavix for blood thinner, somebody has to, okay, use Plavix. As soon as you put there, everybody will know that, yes, this patient's coming here for the urologist, for the dentist, whoever. They're going to know that the patient was treated for something else. I think that's integration. I don't know if I answer your question. It's going to happen. I think it's going to happen. It's going to take a while. Here in the school, it's going to take maybe 2 years to start getting everybody together, right? Because they are starting with the hospital first, then they keep going until they get to the dental school. And we have to adapt. There's always a resistance to that, because we like the old systems.
Yeah.
And now we're going to have a new system, right? It's going to change everything. So, but I think it's a good thing. It's going to be very good.
And how much do you think university politics plays into research and funding and prioritizing some of these ideas?
Well, the politics is because of budget and financial support, right? So the decision is going to be, if I have a dollar, where is going to be this dollar better employed? And then you have the discussions. One may think that this is a good way to spend the dollar. Somebody's going to say, no, it's better to spend on fixing the building. All right. The research funds, most of the schools are dependent on federal support, the National Institute of Health, the NIH. And as you know, what's going on right now, there are some financial constraints that the government's placing, removing the indirect costs that pays for the labs, pays for the employees in the labs, for the lab technicians. So when they cut that, they're not cutting the faculty member. They're cutting the research and they're cutting the jobs be underneath them. So that's what hurts, because there are a lot of people that work in a lab and make this research goes forward. So the institutions have been discussing that, and I think they're getting some agreement that they're going to get something, not all the way, but they're going to get something better than was discussed before. And everything changes. So it's a question of how long the politics is not going to support research as they used to. And then comes another administration that may say, no, let's support more. We need to develop more cancer research or whatever it is that they feel priority at that time. But it's very up and down. Doesn't go in a straight line, but goes up.
Yeah.
Goes up. It's going to be better.
Slow and steady. Well, and I mean, as a teacher, what do you communicate to your students about navigating academia or what to take out of school without burning out in that climate?
Without burning out, that's a good question. Well, it's always difficult, and I tell them everybody will be okay, because I went through that as well, right? When they say I don't have a car, I tell, I was in Michigan, my classmates would say was colder inside my car than outside because it was so rusty, in 1980s. So this is normal, but everybody survives. In the end, is everything okay? I remember having 2 ties. We had to work with ties, and I had a brown and a blue, and we still go to school.
Yeah.
It is normal. It's the way that we go through that phase in life. The issue now, as I told you, is that the tuitions are so expensive and everything's much more expensive than it used to be. We didn't have cell phones. We didn't require all kinds of things that today we do. The computers were just starting with Macintosh, IBM. That's what we had in the 1980s. Today, every year, there's a new model of Apple that if you don't update, doesn't work anymore. Your old Apple 5 years ago. So those are the constraints of the cost, and you need to keep that as low as possible. It's not how much you make, it's how much you spend, and dedicate your time a little bit more to the program. Like I used to say, we spent a lot of time in library in Michigan those days. Today, you can use your electronic library from your computer, but you still have to spend the time and organize your time. You have to spend X amount of time reading and studying. The joke is that if I give a book to the student, they are going to ask me, where do I push the button to open the book, right? where is the button, right?
Yeah.
Because it's different.
Yeah.
But organizing the time and not thinking that that's the end. This is just you're going to pass by, and everybody does, and everybody's going to be okay. It's a great profession. You can work anywhere in the world as a dentist. I came from Brazil here. I had opportunities to even go to Kuwait. I didn't want to go, but you have opportunities to go to other places. I know many dentists that went to Australia. Some work as a clinicians in Saudi Arabia. Think about that. You can go anywhere doing dentistry. Some countries are a little bit more difficult. They restrict a little bit more with the licensures and things like that. But there is a need of dentists in the world today. United States has, according to the data, 55 million Americans without access to care, to
Yeah.
dental care. So there is a huge need, right? So the schools also are trying to help by doing outside sites like Alabama has Decatur, has many other sites, Dalton. They are putting their community clinics outside. Then there is the other side where some private clinicians they don't like that because they're competing with them. But the reality is nobody's working in the cities, so it becomes to the state to say, "Oh, we have a state institution. Let's open something in these areas." What's very beneficial, and it's still in the early stages because we are still learning how to do that well.
Yeah.
Because to hire a faculty member to go there, they don't want to go there. It's very hard. Oh, where is this? It's in the middle, 3 hours from anywhere, closer to a big city. So it's hard. It's much
Yeah.
harder. But we have the students to rotate. We have the residents we can rotate. So the access to care can be something that universities can benefit a lot and can help a lot.
Yeah. I
Is
mean,
that making sense?
you chose Juno Beach, right? For your practice and ran it for a decade.
Yes, well, exactly. When I went, as I told you, I was working for this company that had a West Palm Beach site. In those days, it was before 9/11. I could get 100 subjects for a toothpaste study in West Palm Beach. And then at night, I would get a plane and get another 100 subjects in Miamiville, Ohio. Then came 9/11, became much harder to travel like that fast.
Yeah.
And things became a little difficult to do it, and that's when I decided to open my own practice. Juno Beach, I select there because it was a little bit north of West Palm, and they did not have any periodontists in Juno Beach that time. The Donald Ross Bridge going to Juno was only one, now are two. There was no construction. Now you go there, Michael Jordan lives in the Bears Club, and Celine Dion is there. There was nothing there, nothing. And now it's a big deal, right? Even Tiger Woods moved to Jupiter Island. So changed a lot from 2000 to until 2012, 15 became really, really busy. And if you go there now, there are so many periodontists. I was the only one. Now there are so many that, yeah, but it was a good area to work at that time. And I enjoy it. And people were very nice. I received referrals from the other dentists. And yeah, it was a great experience.
What were some of the biggest challenges doing perio or being the first periodonist in Juno Beach?
Well, trying to receive the referrals because everybody was spread out, right? And yeah, and then I gave lectures I would sponsor a lecture in a hotel myself to dental hygienists. That's what I did first. So because dental hygienists are a good source of referrals to the periodontists from their general dentist. Meeting the front office, mainly the dentists, they're important, but the most important people are the dental hygienists in the front office because they are the ones going to say, go to Dr. Chaves. He's a nice guy. Go there and see him for your perio problems.
Yeah.
And you have to be in a situation where the dentist, the general dentist, is not going to say no because I don't like him, right? So yeah, Dr. Chaves is a nice guy. So let him go, you know.
Yeah.
But sometimes they are not the first source of referral. But the specialists they work on referrals. Yes, that's the way you do it. And there's nobody there at that time in Juno Beach. They were in West Palm, some two big groups in Palm Beach, that's in the island. So there are not too many, not too many. So it was everything's adaptation, right? At that time, you may say, "Oh, you're so lucky there's nobody," but now there are more people there.
Yeah.
So it's the same thing.
Yeah.
It's the same.
Well, being in, running the practice and being in academia for so long, where do you think where do you think dentistry is heading, like based on your experience?
Where is heading right now is heading to all the technology. We're learning how to deal with that, but I think we're going to go back a little bit and start looking, is this the best for the patient? Is this financial constraints that the dentist is having and also the patient is having to have good treatment? How can we minimize that? Right now, as being, look, it's a great profession, everybody's money is flying, right? The implant companies are charging as much as they want, and they increase the prices of their fixtures, the dental implants, all the time. Something that was 180, 280, now you have $500, $600 cost.
Yeah.
Plus the putting the crown on top of it, and $600 cost. So if
Yeah.
you add that, if you're like, this is already more than $1,000 cost. Then you have the time of the dentist to do the work. It's an expensive procedure, right? That's where we are now. Many companies are developing a second line, a little less expensive. So the same company has two types, two brands, one more expensive, one less expensive. And I feel like, well, but if they both work well, why do I need to put the most expensive one, right? Why?
Yeah.
Doesn't make any sense. I think this is going to happen. They are going to have to maybe streamline, make a cost that has a value for that, and the value is fair, and stop with this so many types because it confuses everybody. If
Yeah.
you go to the dentist and you don't even know what implant they have in their mouth, and every screw or every wrench or driver is a specific for that implant, so you have to buy so many because they're all different. So that has to improve in some ways, make easier, not just for the dentist but for the patient as well. The poor patients, I don't know what I have in my mouth, I don't know what they place it, nobody can fix it
Right.
because the tools don't fit.
Yeah.
It's a little bit too much right now.
Well, what's giving you hope?
What's giving me hope, I used to read a lot of Thomas Jefferson, and he believed in the human nature, right? He believes in the good of the human nature. He also believed that the majority would always have the correct answer. And if you didn't agree with the majority, you should accept or you move, right? Because that's the way it's going to be. So I still believe that in the end, if I see my students and every day, people are good, people are nice. They don't want to hurt you. They want to do the best for you, right? Everybody's trying the best they can. And I still believe that that's going to really make the difference in the end. People are going to say, this is too expensive. I'm going to do better. I don't want to hurt this patient. I'm going to do better. I'm not be looking into buying a new boat or a bigger house or all the best phones. You make good living in dentistry. And I used to say that if you really want to make money, you're in the wrong profession. You should do like export, import, or work in the shipyard or something. That's where you have the containers with lots of money there. Dentistry, you have a good living, no question about it. But it's not something that you can compare with, the baseball players or football players. It's not that level. It's not that level. Although there is the joke from one of the comedians, I think it's Chris Rock. He said, "What is this Dennis living in the same neighborhood as a Patrick Ewing? He strikes teeth. How can he live in that same neighborhood, right?" So that was a joke from Chris Rock. But that the dentist lives in the same neighborhood as a Patrick Ewing.
Right.
So it is possible, but it's not everybody. It's not everybody, right?
Yeah.
The majority is going to have a good living. We're going to treat patients well. I still believe in the human nature that we are going to continue doing that as being one of the professions that people trust the most. You are in a four walls, you and the patient. You can do whatever you want in a way of good or bad, right?
Yeah.
So you still do good. So that's impressive, I think. I would say the majority, right? The ethics prevails there because the human nature of people that I don't want to do anything bad towards somebody else, right?
Yeah.
I
Yeah.
think that's my hope that human nature will prevail. What do you
Yeah.
think?
I love that. I think that's a great hope. Well, and to wrap it up, like what's one message that you'd leave for the profession before retiring to Brazil?
Yeah, we didn't mention that, but I am in my beginning of the winter, end of fall of my career or my life, and then I'm planning to retire in Brazil. And Again, when I say that I'm going to retire there, my friends start calling me, why don't you work with me 1 day or 2 days? So I don't even know how to retire.
Yeah.
But my sisters are older as well, and I need to go back maybe next year. I came to Alabama for the last year or two to help here because most of the periodontists moved to dean positions, associate dean positions, and I felt they need somebody to help here. That's why I came. But I'm going to retire in a way of going to Brazil and resting and exercising and doing the things, but I think I still be involved with dentistry in some way. I still be involved with not only in patient care, but in the educational system. Many Brazilians want to come to the US to study here. I
Yeah.
think I can help with that. So more likely I'll be doing something like that.
Yeah. Always an educator.
Yeah.
Well, Dr. Chavez, this has been incredible. Thanks for sharing such a rare and honest perspective and staying curious and humble and keeping patients at the center of your educational journey. I really appreciate having you on.
Nick, thank you very much for having me, and I hope that I contribute to your podcast.
Oh, you sure did. Until next time.
Until next time, Nick, thank you. Have a good one.